My name is Stephen Carpenter, and today we're going to look at assisted stand-up pivot transfers from bed to a chair. Specifically, we're going to be looking at three different patients: a patient with total hip replacement, a patient with sternal precautions, and a patient with hemiplegia. So first, we're going to look at a patient with total hip replacement. Just like all your patients, you're going to want them to start at the edge of the bed with their feet flat on the floor. And for this skill, we're going to be using the walker to help assist move the patient. For this patient, you're going to want to instruct them to keep their leg underneath them at the entire time with their kneecap facing forward as much as possible. And when we're moving with the walker, I'm going to help you stand up, and you're going to use this for stability and balance. And then as we're moving, I'm going to need you to move the walker and then your leg. Okay? With all these patients, you're going to make sure you move toward their strong side. Okay? So move this closer. Help you keep on the count of three. I need you to grab onto the walker. Push yourself up. Ready? 1, 2, 3. Good. And we're just going to move the walker first and then step. Good. Walker, step. Walker, step. Go back 1 step. And down. Just like that. The second patient we're going to be looking at is a patient with sternal precautions. And this patient is not going to be able to use any of their upper body due to some procedure or injury that they've had. So we are going to give them a pillow, and they're going to hold this pillow across their chest throughout the entire motion. So that's going to keep them from using any of their upper body for any assistance. So I'm just going to help you stand up on the count of 3. 1, 2, 3. Up. And we're just going to slowly pivot, step, and then down. Good. Down. The third patient we're going to look at is a patient with hemiplegia. And this patient is not going to be able to move their upper extremity or their lower extremity on their affected side. So we're going to use a cane to help with this assisted transfer. So we're going to start in the same position that you do with all the other patients, and you're going to instruct the patient. So when I lift up on you, you're going to use the cane to help you lift yourself up onto your strong leg. And as we're moving along, you're going to want to step with the cane and then with your leg, and I'm going to support you on your weak side so you don't fall over. Okay? And we're going to kind of swivel around and sit you down in that chair.